Okay, so that brings us to our next panel, which is how a health crisis can become a financial crisis. Now, I've just been told right at this moment that one of our panelists, Louise Sanford from the Cancer Society, isn't going to be able to join us because she is nursing a sick aunt. Now, I do have some emails from Louise, so hopefully I can run through to a certain degree what she planned to cover. But in the meantime, I would like to invite up Don Scandrett from the Stroke Foundation and Terry Doran from the Heart Foundation. Just a reminder while we're just getting ready, if you could text any questions to 021 902 850, and we will endeavour to get through all the questions that we can. So this session is how a health crisis can become a financial crisis. What are the realities of dealing with cancer, stroke or heart disease, and what is the financial toll for people with these serious illnesses and their families? Now, the members of our panel, they're very much involved at a grassroots level with the people that we're talking about, with real people out there who are suffering illnesses and finding that there is a huge gap. Now, I'm going to run through some questions with them and they will answer them. So we have Terry Doran from the Heart Foundation, whose role is nurse liaison, and as I said earlier, Terry has stepped in for one of her colleagues. And we've got Don Scandrett, who's Northern Regional Manager for the Stroke Foundation. So the first question goes to Don, and it's a devil's advocate question, and it's one that I believe, and I'm sure that a lot of you believe it as well, is that stroke is an old person's disease. And so, Don, surely it's an old person's disease and they're going to get NZ Super anyway, so why should they be concerned about stroke?
That's a real common myth, Diana, that a lot of people thinking, strokes only happen to people, older people, people over the age of 65. Strokes can happen to anyone. Typically in New Zealand there'll be about 40 kids under the age of 16 years that will have a stroke in any 1 year. So strokes can happen from babies up to, people over 100. We do get people over 100 have their first stroke. Typically in New Zealand, 25% of people that have a stroke are under the age of 65. But specifically in parts of Auckland, I'm talking about South Auckland, currently it's 40% are under the age of 65 that's having strokes, and that's been increasing by about 2 to 3% a year the last few years, which is quite scary. So I guess, you're looking at, Super's going to look after me. With the amount of people under the age of 65, we see more and more cases of, might be the sole income earner in the family, might have a stroke, and if they've got a number of dependents, that places huge pressures on that family. And we see it all the time, it's just soul destroying for that family because, trying to make ends meet, so that's really, really difficult.
Thank you. Will a stroke stop you working for the rest of your life? If I have a stroke this afternoon, is that the end of my career?
Well, it really depends on whereabouts in the brain the stroke has occurred, because there's different parts of your brain control different functions of your body. So again, it's really, really dependent. Like, there's the obvious signs that you can see from a stroke, which might be, difficulty with communication, or difficulty with, might be not be able to use a limb or an arm or a leg or something like that. But there's also stuff that you can't see. Quite a number of people have their eyesight affected. It might be their peripheral vision might be affected. There could be issues with their cognition. So you might look at someone and think that this person is absolutely knows what's going on when the fact is they find that really, really difficult. So that can be really challenging. There could be memory issues which on the face of it might be really hard to pick up. So that makes it really difficult. For example, if you're someone that's, say, a professional driver, it might be a truck driver, drive a bus, or be a pilot. Typically, if you have a stroke, there's absolutely a minimum of 3 years before you could even consider to go back and pick up that profession. So in a lot of cases, that's not going to be an option. So imagine if you're, for example, a truck driver in your 50s, you have a stroke, you've driven a truck all your life. So essentially that's the end of your career. So at that stage it gets really difficult. Just use another example for someone that's, talking is very much part of what they do. For example, if you're a salesperson, if you're a public speaker or even a politician, just imagine if suddenly you lose the ability to speak, how that's going to affect you. And that's the sort of thing that we see on a regular basis, and people are dealing with that on a regular basis as well.
Thank you. You mentioned that there's people who think I've paid taxes all my life and I'll be looked after, and I'm sure that everybody in the audience has heard that. They've paid taxes, they're going to be looked after by the government. This doesn't always happen, and do you see examples of financial stress and financial hardship as a result of stroke?
Yeah, well, I talked about the families where they have the sole income earner has had a stroke, and the burden that places on that family unit. So that's a very real one that we see on a frequent basis. We also, another example of financial hardship, just an example that I've seen recently, it was a woman that was in her 40s. She was self-employed. She had a stroke, and as a result of that, she decided that she owned her own home. She decided that she would not be able to keep up with the mortgage payments. So she was forced to, made the decision to sell her home. And that way she's sort of gone back from, saved up for years to the extent that she had invested in the home, whereas now her income had dropped, so she's reliant on a benefit. So that person's really, really struggling now, and she's finding it really difficult.
Yeah. And do you have any more examples that you could tell us of people who've sort of experienced stroke and the effect it's had on their day-to-day income?
You get examples, and it's I guess again the example I was using was the people that are relying on communication is a difficult one. I've seen a couple of people that we've been involved with just in the last few months. Again, where they've been, and this is probably using the analogy with the people here, they'd been a salesperson selling insurance actually, and so that meant they no longer had that ability to provide that income. They even got to the stage where they had to have other people come in and provide support for them. So again, that's providing sort of increased difficulty for that person and for that family. It's really difficult.
Yeah, thank you. I think that probably people don't realise how difficult it's going to be until it actually hits them, or it hits somebody that they know, and then they become aware of it, which I think relates back to some of the research that showed that when people have experience of an incident, they do actually understand that they need this cover, and they may not understand before then. So now I've got some questions for Terry. Okay, so now I know I've fallen into this when I was younger, perhaps not now, but we all feel 100 foot tall and bulletproof. We do. A 25-year-old, I'm sure if there's any 25-year-olds in this audience, they probably feel 100 foot tall and bulletproof. But as your life goes on a little bit further, you suddenly start to feel more vulnerable, and then certainly at my age, which I won't say what that is exactly, but it's getting on, and there's people around me, left, right and centre, getting cancer, having all sorts of illnesses, and it's suddenly all hitting me in the face. Mm-hmm. So when it comes to heart disease, we assume it's disease again of older people, and mainly older males. Does it happen to working people as well?
Yeah, well, I mean, that's the thing. We do associate heart attacks with, increasing age in the older people, but we know from recent statistics from the Ministry of Health that 40% of people that are discharged from hospital post-heart attack are aged between 25 and 65. So, the statistics speak for themselves. Of that group, nearly 80% of them are in the 50 to 65 age group. If we had to add those between 65 and 75, of which many are still working in that age group, then 62% of people discharged from hospital, are under 75 years of age, a high number of the working population. We do know that 9 people are admitted to hospital each day in New Zealand with heart attack or angina. So it does affect, younger age groups than we believe.
Yes. And have you seen them in your practice? younger people who've had heart attacks and must have been a surprise to them.
Yeah, and you know, it's you see it all the time where they don't, you know, they don't see the signs, they don't actually feel anything, and all of a sudden their life's turned around and upside down because they've had, you know, a heart event. I was out last week visiting some medical professionals in the Gisborne area, and yeah, quite a few stories of, you know, people in their 40s who had just had a heart event. So yeah, it's a reality.
And they're shocked, I presume.
Yeah, and the families, it's the whole ripple effect, you know, and a lot of these are the main breadwinners for the families also. So it's a huge effect for people who, in the working population and for families out there. It's a reality.
And as you say, age 40, you've still got 25 or even 35 years of work ahead of you.
Yeah,
So it's
you're
a
working
long
until you're in
time.
your 70s, so yeah, it's huge.
I understand that you hear from a lot of people who don't expect them to happen to them, and there might be a need to save to cover time off work. Do you think there's more of a need for people to save?
Yeah, I mean, the Heart Foundation has a health inquiry line, and we get all sorts of calls from people just wanting to know about heart health, general questions, ranging from just cholesterol, what's normal cholesterol levels, through to, you know, concerns about heart disease. And more of the queries are coming through about financial questions. A lot of them, again, is related to the driving. Driving's a big issue if you've had a heart event. One of the most recent ones we had was from a very distraught young girl who called up because her father had been discharged, he'd had a heart attack and had open heart surgery afterwards. Now the concern was that he was quite a high earner prior to his event, so financially they were stable. However, he needed more time off than the sickness entitlement allowed him to. So when he inquired about benefits or help from the government, he learned that he's not entitled to any. They didn't have any savings. So she had phoned up distraught because he was now in the position where he was saying, I have to go back to work, because he had bills to pay, mortgage to pay, lifestyle costs. And she was distraught at the thought that her father was having to go back to work when he wasn't ready. He wasn't well enough to be back working. And these are real concerns for people and patients and families.
It often amazes me how often there are people earning maybe 100,000 or more who have no savings and who spend all their money.
Yeah.
They go through the spending creep. As their income goes up, they spend more and more. And quite often, actually, they're not just spending to the total of their income, they're spending to the total of their credit.
Yeah.
And these people simply have zero saving. I mean, to me, it's totally foreign, and I'm sure to some of you in the audience it is, but it's the reality of New Zealand.
Yeah.
So, and I'm sure that you see, like this man, for example, who had earned a good income but hadn't saved. And I can see people nodding in the audience. When working people are diagnosed with heart disease, can they continue working in their existing job? This interested me as a question because you assume that heart disease, that's it, but some people won't get treatment immediately and some people will be able to go back and some won't, I presume. So what do you see on the ground?
I mean, every case is different. It's all about the individual's sort of treatment and recovery. Also depends on what type of event that they've had and how much of the heart muscle's been damaged, whether their employment involves, you know, heavy manual jobs or whether it's a sedentary job. So, I mean, some people can be back, depending on the event and the treatment they've had afterwards. Obviously, if they have, you know, a procedure for a stent to open up the artery, or if they have open heart surgery, or if they're managed medically, that all impacts in how quickly they can return to work, or if they can return to the same job. Some people can be back to work, you know, within a week. You'd think rare after a heart attack, but some people can be off for several months. It also depends on, you know, a lot of people who have had a heart attack can also have coexisting medical conditions. So really, it varies quite dramatically depending on the individual, the event and the treatment, and of course the type of job. And again, one of the heaviest jobs affected is driving, because they have to be, you know, the New Zealand Transport Agency, it's a minimum of 4 weeks before you can apply after heart surgery. But the reality is that many people have to apply and get signed off by the specialist, that can see them waiting for a few months, depending on their priority and where they are in the system. And that again can cause a lot of stress and anxiety to individuals in terms of income and loss of.
And anxiety is probably the last thing they need when they've just had a heart attack.
Exactly. And that's the other thing also, that, with the pre-existing conditions, depression is something that's, related to events like heart attack.
So it's a cause of or a result of or both?
Well, yeah, with any long-term condition or any sort of life-changing event like that, it can predispose to depression.
Mm-hmm. It's something you probably don't think about when you're thinking about heart attacks and heart conditions, about the other related things that you may suffer.
Yeah.
Okay, so both of you have talked a lot about driving. It was interesting talking to both the Heart Foundation and the Stroke Foundation, because both of them kept talking about, the people I was talking there kept talking about drivers and the fact that drivers can be affected. And I remember an airline pilot friend of mine who once described himself as a bus driver, and it's quite true because they are driving a bus that's just in the air. And you don't think about how long they might be off work for. And the fact that they have to wait possibly months for surgery if it's not acute. They have to wait months for surgery, and then months after that before they can go back to work. And by then, most of them will be in the 50% that can only last 4 weeks.
Yeah.
Okay, so the okay, so you've covered that. Sorry. Okay, so if you can just talk a bit more about the waiting lists, because I have these images, and this was my uncle in the 80s who was on holiday in Australia, and he fell down with a heart attack, and he had instant open heart surgery, and then it was all dealt with instantly. But I understand that waiting lists do play a big part for people with heart conditions, and if you could just go through and explain the waiting lists a bit more would be good.
Yeah, again, depending, as you said, the level of severity and disease and how that person is seen as a priority. So there can be delays up to several weeks for some people, and in the meantime they're suffering the other effects of this. They could be suffering from exertional angina, where they're getting chest pain. They could be having shortness of breath that can prevent them from working while they're waiting on the waiting list for the treatment or the surgery that they need. And for others it's the mental battle that they have during that wait. They can be too scared to return to work because they're having these symptoms. They don't know what's ahead of them. They don't know what they can do and can't do. So there's that limbo period, and that can require a lot of support from mental health interventions as well. So there can be anything between 6 weeks to 3 months recovery time afterwards, plus the wait beforehand. So. And it depends, I suppose, on where you are in New Zealand as well. And
I'm not going to ask you a question about this, but one group that you mentioned was the 65 to 75-year-olds who are still working, and there's a large number of those in our society who can't live on national super alone. But obviously they won't be eligible, most of them, for income protection, and they will simply have to go on to New Zealand Super. So there's actually quite a big group there which will struggle, and it's a group in society that I find that worries me, that people have to work that late, that long in life, and the fact that they are financially vulnerable if they have to stop working. Now, as you know, I only heard just as they came to sit down that Louise wasn't coming, and sadly I have actually some answers from her on my phone, which I'd have you sitting here for hours while I found them. But I do have a few notes from her, just from our conversations, which I'll read through. But unfortunately, they're more bullet points that she was going to talk about. So whether they make 100% sense, I'm not sure, but I will endeavour to do my best, and then we'll move on to questions. I do know that one thing that concerned Louise, and we had conversations about this, was that she has a big concern that the income protection insurance, that the stand down period's too long. But I think that, like much of the public, she doesn't understand that you pay for that stand down period. So if you want a shorter stand down period, you pay a higher premium, and if you want a longer stand down period, you get a smaller premium. And I think that is something that we perhaps need to educate the public more about, that if they need a 3-week stand down period or 4-week stand down period, they do need to pay for it. And that does come at a cost, unfortunately, which a lot of people cannot afford. So Please, I apologise if I'm reading from this. The thing is that one of the things that Louise said to me was that there's an irony that at the very time when people need more money, they suddenly lose their income. So they're diagnosed with cancer, and it's probably the same for the heart condition or for stroke, and they need money to get to appointments, and they need money sometimes to pay for treatments that aren't covered by Pharmac, and they need money for all sorts of things, and they quite often, just at that point where they're just living within their income, they suddenly find their expenses get greater, and yet they have no income coming in. And it's something that the public perhaps don't think about, and that we, those of us who educate the public in different ways, need to get through to them, although it's actually very difficult to get any concept to do with insurance through to the public, as I'm sure a few of you know. And she gave the example of sometimes they'll need to eat very specific foods, or they may want to suddenly improve their diet. If you've been diagnosed with cancer and your diet's McDonald's and KFC, you might actually want to learn more about nutrition and eat better, and this will generally cost you more money. And that the often anti-nausea prescription she was talking about that cost you quite a lot of money, and that you may just need to catch a taxi to treatment, or you may in fact need to move. If you're living in Matamata, you have to come up to Auckland for treatment. And there are some costs that are covered by the health department, which Louise was going to talk about, but they're not all costs, and they're not all covered. So if you live in Matamata and you're struggling on your income as it is at the moment, and you have to go to either Hamilton or Auckland, it's going to cost you additional money. And you may actually need to pay for childcare, and that's something I think with life insurance and income protection that people don't think about, that suddenly somebody's going to have to look after those children. You may be a single parent, or you may be that your partner is having to go out to work to cover your income, and those children need looking after while you come up to Auckland or Hamilton, or if you're in the South Island, to Christchurch for your treatment. And she says that a lot of people feel psychologically a burden, that they're putting a burden on their loved ones when cancer happens, and that the income protection insurance, or actually having that income protection coming in, would help them enormously. But as we know, very few people have that income protection insurance. And she says that if a patient's caught up worrying about how they're going to cover all these costs, it actually doesn't help their treatment and their recovery, which I'm sure is the same for both stroke and heart disease and many other illnesses. And she's saying, as we probably know, that a lot of people, even if they have to work, they're probably going to work part-time. They're not going to be able to carry on with their full-time jobs. And that she said that they have come across cases where some people choose not to have treatment. They're diagnosed with cancer and they choose not to have treatment because of what it's going to cost them. And having to go through that as an individual, that would be horrifying to think that I have cancer, I am going to choose not to be treated because I can't afford it. And yet that is happening in our society. So that was Louise's comments. And I'm sorry that she's not here to actually read them out herself. And I have some questions. So this is one for Dom. What's the average age of a stroke, and is this trend line getting younger or older?
The average age that we're sort of seeing in the northern region, so that's the Auckland and Northland area, would be in the vicinity of about 69, 70. What we're seeing, there's a study that's been done in the Auckland area for the last 40 years. Every 10 years that they'll do a study and they'll look at everyone that's had a stroke in that year and what's happened with that. So what we're seeing is there's been an overall decline in the rate of stroke, with the exception of the Maori and Pacific Island populations haven't declined quite at the same rate. But what we've also seen is more and more younger people are having stroke than what we've seen before. So there's been huge medical advances. Seeing less and less, and a lot less people are dying of stroke now than what they used to. But the other side of that, we're seeing some people that are severely disabled. Certainly my team in the northern region are dealing with some cases that are some pretty pretty dire circumstances that people have gone through, and in most cases those are younger people as well.
And males or females?
Well, it's actually, as far as deaths, is about 60% of women die of stroke. I actually thought strokes tended to be more male-dominated, but 60% die of 60% of women die of stroke. So, you know, when we look at stroke survivors, pretty evenly balanced between men and women.
So 60% of women who had a stroke die from it? Or did I misread that?
60% of deaths,
Of deaths?
of stroke deaths occur in women, yeah.
Oh, women, that's interesting. That's very interesting. And just a question from me, why is it getting younger? Why is the demographic getting younger for strokes?
Part of it, you know, certainly what we're seeing is I guess, there's been a real trend, I guess the last 10 years, you're looking at sort of, everyone's sort of going for the trends to go for low fat. So you go for low fat foods, so you take out, you know, you take the fat out and it affects the taste. So what do? You pile in sugar, you pile in salt, and they pose and, you know, bring in all sorts of other health conditions as well. So, for example, salt is really, if you want to really increase your blood pressure, have lots and lots of salt. And so it's things like that. We're seeing more and more people with high blood pressure. We're getting, you know, high cholesterol. That's another risk factor. So it's things like that, and it's probably linked in with diet, a lack of physical activity, things like that. Very much the same things that affect heart disease as well.
Yes, it definitely sounds like that. I'm sure that the younger generation as well is eating a lot more processed foods, and we've had various discussions over dinner recently because I accidentally bought low-fat mayonnaise, and we've been reading the back of the packet of all the things in it and the sugars and all sorts of things in this low-fat mayonnaise, but I'm too much of a tightwad to throw it out and go and buy another one. Oh, hang on, this phone keeps going to sleep on me. Sorry, it's not my phone. Does risk of heart attack peak nationally in the 45 to 55 age group, do you know, Terry?
How do you mean, does it peak?
Does risk of heart attack peak? So what is the highest risk age for? When does it peak? Do you have any idea?
When does it peak? Well, I know, like, from the figures we're seeing more in the sort of 50 to 65 age group, but in terms of peaking, I don't know, that's
No, that's fine. Does it have any more questions on this? Okay. Look, you were talking about heart attacks that were managed medically. Mm-hmm. What do you mean by that exactly?
Well, if I'm talking about the difference between a heart attack being managed by, you know, a procedure, like a open heart surgery or stent or procedure, to be, you know, managed by drugs, medication, and other interventions.
And so am I more likely to get back to work if I have medical management or if I have a procedure, or are they not related?
Well, obviously if you have a procedure like open heart surgery, then your time off work can be a lot more than if you hadn't, because obviously you know, if you've had open heart surgery, it can take, you know, up to 3 months for, you know, the sternum, the breasts going here to heal, and if you're in a manual lifting job, things like that should be avoided. Sure. But, you know, it depends on the individual and their own recovery times as well.
Yeah.
It's very...
have you seen cases where people can't get back to work at all?
Yeah, I think, you know, you do see cases where people, you know, never return to work, and again, it just depends on what job that they carried out beforehand. You know, a lot of people don't have a plan B in some jobs, especially a lot of the sort of manual types of work. I mean, you would hope that most people can get back to some sort of work. Very rarely have I seen nobody that's returned to nothing. And again, it depends on their age and stage of life and other factors. Yes. But it varies. It can vary, you know, dramatically from individual to individual.
Sure. Okay. So this is from a member of the audience. In my experience, those that suffer serious illness can be advocates for getting insurances. Have either of the organisations ever partnered with insurance professionals and these advocates?
Certainly in the past, the Stroke Foundation has partnered with different organisations where they've used case studies or people that have been affected as a means to promote that. Currently we don't. We're in the market for something like that. So if anyone wants to come and talk to me afterwards.
I think you've got all of our leading insurers in here, so hopefully there'll be a partnership brokered at the break. And our next question from the audience. This is an interesting one, and I'm sure it's actually very important. How much does certainty of income help in the recovery of those hit by stroke or heart? And I can imagine myself being very stressed after one of those events, and I've got a stressful job, so actually having that income protection coming in would allow me to relax.
I mean, certainly, it goes without saying that it's another factor that can delay people in the healing process if they're stressed or worried or anxious about money. So I would imagine that it is a big factor. Again, going back to people who are returning to work too soon after a heart attack because they don't have any other source of income can be a huge concern in their health and their recovery, and also the risk of further events, because we do know that people who have heart attacks are at high risk of having another event, so it's another factor.
Oh, absolutely, and it's certainly the same for us. I actually heard of an example recently where a guy, he'd only commenced new employment, he'd been in the role a matter of weeks, and he had a mild stroke, which he masked from his workmates and colleagues, because he was worried that he hadn't been employed long enough, so he wasn't qualified, wasn't going to get any sick leave or anything like that. And he ended up having quite a large stroke about 3 weeks after that, and it might have been his secondary stroke might have been preventable if he'd done something initially. So it gets very difficult. So it's what you're trying to do is you're trying to reduce that risk of anxiety, and certainly if you're worrying about how are you going to feed your family, how you're going to keep your family together, how the mortgage is going to be paid, that's really going to affect your ability to recover. What you see in a lot of people that have been affected by stroke and brain injury, as a way that the brain recovers, you get fatigue is such a big issue. So we'll go and do a day's work and we'll feel tired, but it's nothing like the fatigue you feel when you've had a brain injury. And that's something that a lot of people don't take into consideration, that fatigue and the ability to think clearly about what you're doing and how you're going to recover and things like that.
Are you able to give us just a guesstimate, and we won't quote you on it, but a guesstimate of what percentage of people who that you deal with who've gone back to work too soon?
I would have no idea for that, Diane.
No. Do you have any other examples? You had the example of the man who went back, didn't tell his workmates.
Yep.
Do you have other examples of where they've gone back to work too soon?
Yeah, we had one example. It was quite an unusual one, I thought. I had a ring from an employer. They were worried about, they had a greenhouse. So they had an employee that had a stroke, and this woman had decided that she wanted to come back to work. And her role, she wasn't driving or anything like that, but the employer was quite concerned about this woman's ability to function in I guess, the greenhouse environment where there was forklifts moving around and tractors and things like that. And then that afternoon I actually had a phone call from the union that was looking, or this lady belonged to, and he was, this union person was absolutely concerned about this person's welfare as well. So you got both the employer and the union, both had the exact same concerns, which I thought was quite unusual. As it was, it turned out that it wasn't possible for this woman to continue in that employment. It was just the risk of someone running over her was just too great. She just couldn't manage that risk at that time, and she ended up leaving that job.
I think we often don't think of those details of just really how it affects people on the ground, and this is why it's very interesting to hear these stories. Now, another question from the floor. In your experience when talking to patients, how is the need for medical insurance viewed? And I presume by whoever asked this question, you mean just standard health insurance, not income protection. Is that correct? Someone out there asked it, but anyway. So in your experience when talking to patients, how is the need for medical insurance as opposed to income protection viewed?
I don't, in my role, I haven't come across specific examples that where there has been that expressed to me, so I can't answer that one.
No. Okay, Terry?
Yeah, I think it's, from a health professional's point of view, you're more likely to get involved in discussing with patients about medical insurance. It's one of the things that, you would ask them if they come for a consultation and they need referral, but income protection, not so much.
I think that the public simply doesn't know the difference often between medical insurance, or they may know of medical insurance but never heard of any type of income protection insurance. And they often think it's important to have medical insurance, but they don't think about the other insurances. And I know myself, if I have to have a hip replacement tomorrow, which is unlikely, that I can go out and pay for it from savings. And so most of those medical insurance things, although you may have a $100,000 bill on cancer, breast cancer or something like that, but those things that you can, a lot of people can pay out of savings, but they can't necessarily cover a year or two's income out of savings. And yet there seems to be a lower understanding of income protection insurance compared to something that just pays your medical bills.
Exactly, and I think as well, if you're seeing patients within secondary or tertiary care, it's a lot of time post-event or post-diagnosis.
I think on that note, unless there's any more questions coming in, we will break early. Oh, you'll just double check. So just double check there's no more questions, and if not, we'll break for morning tea a little bit early and give you time to speak to the previous speakers or to anybody from the FSC. No? So just, if you just join me in thanking Don and Terry